substantial economic burden on the healthcare system worldwide. Improving glycemic control may delay the onset and hamper the progression of microvascular or macrovascular complications associated with diabetes. Some empirical studies found that long-term glycemic control can be effectively managed through dietary control and lifestyle changes, but adherence to prescribed medication is the most important aspect of diabetes management. In addition, some studies found that duration of diabetes has been an increased risk of the development of complications. An improvement in medication adherence may lead to better glycemic control, which in turn may reduce complication and healthcare utilization, such as the likelihood of hospitalization or emergency department visits. With regard to the adherence to medication and the healthcare expense, some researchers have reported that increasing adherence to medications may actually increase the expense of these medications, but may decrease the expense for other healthcare services. However, whether the higher drug expense would be offset by the reduction in other healthcare services is still controversial. Taiwan's National Health Insurance Program was launched in 1995, provides comprehensive benefits package with low drug cost-sharing requirement. Therefore, we consider that financial barriers to medication should be a minor concern in Taiwan compared to that in the United States. Through use of longitudinal study design, our results aim to examine the relationship between medication adherence and healthcare outcomes and expense for patients with newly diagnosed type 2 diabetes. Furthermore, we also investigate whether the duration of diabetes may play a role in the aforementioned relationship. In terms of method, we use National Health Insurance Claim Data Set from 1999 to 2009. Newly diagnosed patients with type 2 diabetes were identified by making diabetes-related claims during 1999 and 2001 before the index date of diagnosis in 2002. Patients were included in the analysis if they were at least 18 years old. Second, patient had a prescription for medication at index date after initial diagnosis. Third, patients had at least one prescription for medication after the second year of the study period. Finally, patients had no insulin prescription during any of the years in the study period. We compile baseline information for the first year following initial diagnosis, and we collect follow-up information over the subsequent 6 years. As a result, a total of 11,580 persons and 69,480 patient years were included in this study. Dependent variables in the study were healthcare outcome and healthcare expense. Healthcare outcomes were based on whether the patient was hospitalized or had emergency department visits for diabetes-related condition for each year during the study period. And we used 3 variables to measure healthcare expense, including expense associated with oral antihypoglycemic medications, expense for hospitalization or emergency department visits, as well as total healthcare expense. Total healthcare expense include expense for ambulatory care, hospitalization, emergency department visits, library tests, or patient copay. All healthcare expense was adjusted for inflation using Consumer Price Index. Independent variable we include in this study consists of adherence to medication, duration of diabetes, and an interaction term for medication adherence and the duration of diabetes. Adherence to medication was measured using medication possession ratio, which were based on field prescription for 7 oral antihypoglycemic medications. In this study, the NPR was calculated as the number of days of prescribed medication divided total number of days in each study years. Patients were considered to be adherent if NPR equal to or larger than 80%. This cut-off point has been widely used in the previous study to categorize the medication adherence. And the duration of diabetes was divided into two categories, less than 5 years and 5 years or more. Less than 5 years represent the second to fourth year after initial diagnosis. 5 years or more represent the fifth to seventh year after initial diagnosis. And several component factors were controlled for in the regression analysis, including characteristics of patients and healthcare provider. In this study, we used generalized estimation equation with proper distribution and leap. This analysis accounted for intra-class correlation between repeated observation of the same subject. In the results, this figure shows the value of NPR according to the year, and we found average NPR slightly increased from the first year after initial diagnosis to 75.1 in the second year, and then increased in the subsequent year to 88% in the last year of the study period. And this figure shows the health outcome according to the year. We found that the rate of hospitalization decreased from 9% in the first year to 8% in the second year, and also increased in the subsequent year to 11% in the last year of the study period. And this figure shows the healthcare expense according to the year. We found that mean drug expense for hospitalization and ED visits and the total healthcare expense increased during the study period. And this table shows the results of GE regression model concerning the relationship between medication adherence and the healthcare outcome. The first model examined the relationship, and in model 2, an interaction term of medication adherence and the duration of diabetes was incorporated. In model 1, we found that patients with better adherence medications were less likely to be hospitalized for a diabetes-related condition. Similarly, we also found that patients with better medication adherence were less likely to have emergency department visits. In model 2, we found that interaction term revealed that the duration of diabetes significantly moderated the relationship between medication adherence and hospitalization, but did not moderate the medication adherence and the emergency department visits. This table shows the results of GE regression models concerning medication adherence and healthcare expense. We found that patients in adherent group had higher drug expense for medications than did patients in the non-adherent group. However, the patient in the adherent group had a lower expense for hospitalization and emergency department visits than did the patient in non-adherent group. With regard to total healthcare expense, we found that adherence to medication is positively associated with total healthcare expense. In addition, the duration of diabetes significantly moderated the relationship between medication adherence and healthcare expense. The results indicated that for 4 years after initial diagnosis, patients had good medication adherence tend to have higher total healthcare expense than patients who had poor medication adherence. However, the relationship was attenuated at 5 years after initial diagnosis. In discussion, our study support previous studies suggesting that there is a better medication adherence was associated with improved healthcare outcome. This may be due to medication adherence may lead to better glycemic controls and further reduce the need for hospitalization by decreasing the incidence of complications such as microvascular or macrovascular complications. And we also found that better medication adherence was associated with increased total healthcare expense. These are limited and the result tend to be inconclusive in the previous studies. Our study implied that reduced expense for other healthcare services such as the likelihood of hospitalization did not offset the higher drug expense. However, the positive association between medication adherence and the total healthcare expense was attenuated after 5 years following the onset of diabetes. I think given the chronic nature of the diabetes, the duration of diabetes has an increased risk of development of complications. We consider that medication adherence may be more significant with longer duration of diabetes. In conclusion, adherence to medication can improve healthcare outcome, but is associated with higher total healthcare expense, especially during the years immediately following the onset of diabetes. We suggest that long-term follow-up is needed for further investigation. This is my presentation. Thank you.
Thank you very much.